Hi, my name is Victoria Litarne. I'm a registered nurse at Vital Life Nursing, and this educational video is about the condom catheter application. Condom catheter application for male can be a delegable task, meaning the nurse needs to make an assessment and make sure that this procedure is safe and appropriate for this particular gentleman, and then it can be delegated to the unregulated healthcare professional. The delegation of task letter has to be written with the specifics of the catheter size and their procedure of the application. Each client has a specific catheter size, and if the catheter is too tight, it can create the blood flow obstruction, whereas if the catheter is too big for this particular client, it can create leakage during the night and the catheter can easily come off. Therefore, the assessment has to be done by a nurse. The client needs to be completely informed of the procedure, and caregivers or community health workers need to be trained on site by a nurse. In some instances, when the community health worker is familiar with the procedure for a different client, the training can be done remotely if the community health worker is capable to perform the task safely and the DOT is followed. I hope this educational video will help you to understand the procedure better. Application of the condom catheter to a male. Number one, you need to make sure that you have all the necessary equipment next to you. You wash your hands, and after you washed your hands, you put the gloves on and provide perineal care to a client. So you provide the personal care. If the client has a shower before, no perineal care is needed. Otherwise, perineal care has to be provided before application of the condom catheter. So you wash the penis from the tip, rinse it, circular motions all the way to the bottom. Once their penis has been washed with the soapy water, take a different cloth and wash it with clean water to make sure that no soap is left. Otherwise, it's gonna sting. And then once that is done, you can either pat dry or let it air dry. To speed up their process, we can pat dry gently. You need to make sure that penis is completely dry before the application of the catheter. Once we provided perineal care, we need to do the assessment of the penis and of the scrotum, making sure that the skin is clean, dry, no redness, no irritation, no broken areas, so skin integrity. We check the skin integrity. After personal care, we change our gloves because these gloves have been used for personal care. We put new gloves on. Application of the condom catheter is a clean procedure. It is not the sterile procedure, therefore the gloves do not need to be sterile. The condom catheter we use is client specific. Each client has a specific size of the condom catheter that has to be indicated in the DOT. So this is a condom catheter size 25, Hollister brand, and it's self-adhesive. And because it's self-adhesive, we are not using any additional tape around the penis or anything else. To apply the catheter, we need to prepare our equipment. Make sure that the working station is completely clean. There is a blue pad under the penis, or you could use the towel, and we can proceed. So when we open it, try not to touch it inside because, as I mentioned, it is self-adhesive. The inner walls of the catheter are sticky. When we apply the catheter, before we proceed, I'll just walk you through. When we apply the catheter, we need to make sure that about 1 to 2 centimeters is present from the tip of the penis to the tube. So we don't put the penis in that area. That area has to be empty to allow urine flow and to make sure that we are not going to obstruct the blood flow to the penis. If the client is circumcised, we are not pulling anything down because there is no skin, foreskin. If the client is uncircumcised, we need to pull the foreskin towards the base of the penis a bit to make sure that the tip of the penis is exposed. And then we put it pointing the urethra opening precisely in the middle of the catheter. So like that. Try to put it so that the opening, the urethra opening, is pointing to where the tube will be connected. And then with the rolling motion, we are putting the catheter down. What I do usually, I kind of like hold the penis with 2 fingers using the other hand and pulling the catheter down. Basically, we roll it all the way down. You could hold the tip of the penis with your other hand and rolling it down with the second hand. Once it's as down as we can, like in this instance, it's completely down. There is no more I can pull down. What I do, I just grab the penis like that because it's self-adhesive. I grab it like that and hold it, not super tight, not to squeeze too tight, but hold it like that for 10 seconds. That will allow the adhesive part of the catheter to get to stick to the penis. Make sure that it's completely flattened, as low as you can. And right now it is fully secured. You could check it by slightly pulling the catheter and you see that it's not coming off. The next part is to connect the tubing to their catheter extension. Their drainage tube in the bag needs to be closed. Make sure it's closed. If you look inside, you see that the opening is closed. This is the opening which is open, and this way it's closed. It is a clean procedure. It's not a sterile procedure, but because it's going to be a closed system, any closed system can be a source of infection developing later. So we need to make sure that it's all clean and clean with alcohol swab. And then we connect their tube tip into the catheter. We need to push inside this extension as far as we can. That could be tricky. You need to push at the same time, pull their tubing on top of their urinal bag tip, and you need to watch for a few things. You need to make sure that you're not twisting it, because you remember it's self-adhesive. If it twists, it's going to create an obstruction for the urine that can lead to the leakage. So we need to make sure that it's not twisted here, yet it's deep enough for us to be safe that it's not gonna disconnect. When I push, I do roll like twisting motions in different directions, to the left, to the right, but again, not twisting completely so we don't have this happening. If you see what's happening right now, if I were to twist it in one way, it will eventually be like that. And then because it's self-adhesive, there's a chance that it will get stuck. Also, what you need to watch for, if a client is immobile for the night, for example, if you use it for the night or even for the day, the tube has this little part that can irritate the skin. So if it's for the night, I always try to make sure that it's aiming upwards and not towards the leg to make more comfort. And the last thing we need to be sure of is to put the urinal bag below the bladder level. Usually for the night, we leave it in the basin, or there are these hooks, you could hook it to the bed. I like leaving it in the basin because there is nothing below the floor, so we leave it on the floor in the basin. It is always recommended to leave it in the basin in case there is any kind of leakage. Either you forgot to close the clip when you were draining it overnight during the night, or sometimes the equipment can malfunction and whatever the plastic, something happened to the plastic and it starts leaking. To avoid incidences when it leaks on the floor, the best will be to leave it on the in the basin. Also, you could secure using this little clip, you can secure it to the sheets to make sure that the tube, you see what's happening right now when I'm playing around with the bag, the tube gets kinked. So make sure that this is completely straight, and then you could play around with the clip and move it to their best location for you and clip it to the bed. Before you leave the patient or the client for the night, make sure that here there is no obstruction. It can easily happen right now when we were playing with placing the bag on the floor. We were twisting back and forth. So when you are leaving the patient for the night, make sure that this area 1 to 2 centimeters from the tip of the penis is empty, not kinked, and also not all the way. Like the penis cannot touch the tube. We need to have this area empty. To remove a condom catheter, we need to peel it off the penis, and then we disconnect the connection. Do not disconnect the tube before removing the catheter, because that could cause the urinal leakage from their opening here. Simply peel off or use rolling motions of their catheter. So like that. It's actually quite easy, way easier than applying. You pull it off. So the best is to put the blue pad, maybe take a cloth. Then this is a clean cloth. You wipe in circular motions the head of the penis, and the procedure is done. There are instances when the nurse needs to be called. Those will be when there is no urine flow. If the penis changes color, that could happen, for example, when the catheter applied too tight, or the not appropriate size had been used in the beginning. Then if there is any redness, changes in color, as I said, redness or open area on the penis, that can be irritated because the urine in the catheter creates the environment where it can irritate open skin. If the mental condition of a client changes, that could happen for different reasons, but sometimes when the urine is not flowing, that could cause changes in the mental status, and that has to be brought to the nursing attention immediately. Or if there is any discomfort or pain